Okay, hi, my name is Keisha Seenum. This is my video on taking a horse's vital signs. So I'll start with taking her rectal temperature, but I don't have a thermometer right now, so I'll just demonstrate the process. So first what you would do is you would get your thermometer and you would tie a string to it just in case the horse's anus sucks it in and then it won't get lost inside the horse. And then, so once you have a string tied to it, you can sterilize it with sterilizing swabs, and then you can lubricate it with petroleum jelly for easy inserting. So then, once you have the thermometer prepared, you can insert it into the horse's butt. But you want to make sure your horse is comfortable with this. Some horses are not comfortable with taking their rectal temperature with a thermometer, but other horses are. So basically, you would move the horse's tail, insert the thermometer, and then you would kind of move it to the side so that you would get an accurate temperature on their internal skin, not just what's in the middle. And then, so a horse's temperature should be between 99 and 101 degrees Fahrenheit. And reasons that it may be high is if maybe the horse is fighting an infection, it will be slightly higher. Okay, so now we will do a horse's respiration rate or breathing rate. To do this, you can do it by watching their nostrils, but sometimes they end up trying to sniff you, and that would be an inaccurate reading because when they're sniffing you, it's not their actual respiration rate. So then what I like to do is just to watch their flanks in here to see their inhalations and exhalations. That would be one breath. And you can do this for 15 seconds and then multiply it by 4 so you don't have to count for a whole minute. A horse's normal respiration rate would be 10 to 24 beats per minute. Stress, anxiety, or fear could easily make these rates higher. And then, so you want to take it when the horse is at rest, but there are factors that could affect the respiration rate. The next test is the capillary refill time. This test is pretty simple to take. It's basically how hydrated and stuff your horse is. So what you can do is, it's also called the skin pinch test, but you can just take a pinch of skin like so and then just let it go, and it should bounce back between 1 to 2 seconds, as you can see it did with her. So then signs that it could indicate if the skin didn't bounce back right away is like severe dehydration, and then that wouldn't be good. That's kind of dangerous when your horse is dehydrated. And yeah. Okay, so the next vital sign that we will take is the horse's pulse rate. For this, we will feel the mandibular artery here by the jaw, and you want to feel it with your 2 or one of your forefingers, not your thumb, because your thumb has a pulse of its own. So basically, you find the artery, and then you just start counting from there. Lots of the times you will feel kind of 2 beats, like the lub-dub, and that would be one beat per minute. So then you feel for your artery, and once you find your artery, then you can start counting from there. It's easiest just to do for 15 seconds again and then multiply it by 4 in case your horse all of a sudden moves its head or something. And then the normal pulse rate would be 28 to 44 beats per minute. And yeah, and then factors that could increase your horse's heart rate would be stress, anxiety, or fear again, as well as if they're fighting an infection inside their body, say if they got cut or something. And good. Okay, so when I assessed this horse's temperature the other day when I had my thermometer with me. It was 100 degrees Fahrenheit. Her breathing rate or respiration rate was 15 breaths per minute, and her pulse rate was 40 beats per minute, and her capillary refill time was still the same as bouncing back right away. Good.